The first step in IV catheter placement is to grab your supplies. I'm grabbing my Chlorhex and alcohol scrub here. Second step is to get your tape ready. I am going to be ripping 3 pieces of tape total. My first piece of tape, I'm slitting it down the middle. That will go over why in a couple minutes. I always tab the ends of my tape. It makes life easier when it comes to removing the catheter at the end of the day, or if your patient's arm is swelling due to either if they're laying on their arm a certain way or if the tape was put on too tight. It makes life easier to just look for the tab and loosen the tape instead of having to look for the end of the tape, which blends in really well since it's all white. The second piece of tape, I'm just going to tab the ends of it and make a slit down the far left side of it. It's like halfway through. And then I'm going to grab one last piece of tape that I'm going to just tab the ends of it. I'm not going to cut it down the middle or make a slit in it. I'm just leaving it plain and tabbed. For any hospitalized patient, you do need a T-port. The T-port is basically going to be what connects to an IV bag. Here I am prepping my T-port, flushing it with saline. You do need to flush it out because they have air, that's just how they are. And you don't want to inject air into your patient. That can be deadly. So I'm just going in and making sure all air bubbles are out. After prepping your T-port, you want to shave your patient's arm. You can make a square on top or just make like a bracelet of hairlessness, which is what I do. Then you're going to go in with your Chlorhex scrub and then alcohol. I'm doing the target pattern, which is basically just going from the inside to the out. Next, you want to place your catheter. You want your bevel to be up, which is the hole of the needle of the catheter. Once you see a flash of blood, you're going to push and advance your catheter, which is going to be the colored part. And then I put the port that comes with the catheter just to temporarily block the bleeding. You don't want a bleeding mess. I'm grabbing that first piece of tape and just going around with it. It's the one that was split down the middle. This is going to anchor down, secure your catheter, and you want to put it on snug. You don't want it too tight, you don't want it loose. The second piece of tape is the one with the slit on the far left side of it. These first 2 pieces of tape are really important. You want them to be super snug, secure, because I feel like these are the ones that best secure your catheter. They're really important. Next step would be to remove the port, the temporary port, and replace it with your T-port. You do want to be careful when you do this. You can sometimes get some blood to come out like I did. I'm just holding off on top so no blood comes out. And screwing in my T-port. I'm going to get that other piece of skinny tape that I tore in half. And I'm just going to cross it over on top of the T-port, just below the plug where you inject. I didn't record this part, but you're supposed to flush your catheter after you tape it down, which would be that yellow plug right there on the far left side. My last piece of tape, I'm going to go under and over on that little butterfly part, and then just adjust the T-port line so that way it fits nice and doesn't make any weird kinks. And I'm just going to tape it down and around the arm. That is the end of the taping part. I'm just making sure everything sticks. And the final step in catheter placement is to wrap it with vet wrap just to protect it. We use the color red because it just says, hey, my patient still has a catheter, they can't go home with it. So it's just a bright color to remind us that this patient does have an IV catheter. and you're all set.